And I just want to touch on kind of some of these side effects just a little bit, because these are the conversations that really change or should change or impact how a patient decides to go about course of treatment. How are you having these conversations about, like, let's say the cumulative toxicities of some of these, like the CDK4/6 inhibitors and things like that, versus conversations about, the risk of interstitial lung disease? How are you kind of handling those conversations? And are patients making kind of different decisions about treatment, or is it just kind of a good to
Yeah.
know?
No, I think people are, right? And I think it takes time. And it's not a one-time conversation. I think sometimes we have to come back and we have to think about it. And I always say to patients, I want you to go home and do your research and think about it. And then you don't have to make a decision today. But I think it looks at what are the patient's underlying medical problems? What is their medical history, right? That's a big part of it. What are their goals in treatment? And understanding that we can dose reduce when we need to. So sometimes patients, we want to make sure we're open about that conversation. We're going to start at this dose, and sometimes for certain drugs, we'll start at a lower dose and, escalate. We saw some data at this meeting about early stage breast cancer, but using abemaciclib, which is a lot of GI side effects, and doing a dose escalation rather than starting at that dose and working down, but over time, over a period of weeks, increasing the dose. And that actually seems to be a really feasible thing that we can do. And so really working with patients about side effect management. I think one of the challenges is that, you know, when someone says, well, the side effects are well tolerated, right? Well, what does that really mean? Because for each patient, well tolerated is different. For a patient, 1 or 2 episodes of diarrhea may be too much. If they are not sure when it's happening, they can't leave the house. On the other hand, some people are okay with that. So it's really that focused conversation about priorities and side effects, and understanding too that once we start something, we can pivot, we can adjust, we can really, but it's an ongoing conversation.
What are some practical considerations out maybe outside of cost? I'm thinking about like location, and things like that, as far as getting back and forth to clinic. What are some things that you hope that research considers in the future that may be being missed now?
I mean, I think really thinking about time toxicity, right? How much time are patients spending in the infusion chair, at visits? It's a lot of time for doctors' visits, and then all the ancillary tests that come with being on treatment, right? Blood work and scans and echocardiograms and all of that. So I think, I would love to see us focus on that, right? In terms of really thinking about how do we truly improve the lives of patients living with metastatic breast cancer beyond the therapies, right? But in terms of all of the other things, support, caregiver support, patient support, all of those things are really, really important. And I think we've really come a long way. I mean, but we still have a long way to go.